Thank you, Mr. Speaker, and I'll be sharing my time with the honourable member from Edmonton Strathcona. COVID-19 has been a tragic time for many, especially for the people working and living in for-profit long-term care. In fact, during the first wave, 82% of COVID deaths in Canada happened in long-term care. There has been over 12,000 long-term care residents and workers who have died since the start of the pandemic in Canada. We know that residents and workers in for-profit long-term care homes have a higher risk of infection and death than those in non-profit homes. And these conditions, these unacceptable conditions, have been further highlighted during the pandemic. The poor living conditions for individuals living in for-profit long-term care. Elders and many disabled adults that have been denied the right to live in dignity as a result of cuts, underfunding, and privatization. Profits should never be gained off the violations of an individual's dignity, Madam Speaker. It is beyond time we take profit out of care. It is beyond time that individuals residing in long-term care are provided with a care guarantee that ensures a safe and dignified life. And it is beyond time that young disabled persons are provided with a choice about whether they even wish to reside within residential care. In fact, Dr. Abraham Saderman, noted director of neuropsychiatry clinic at the University Health Network's Rehabilitation Institute, noted that, in quotes, essentially, it is a default scenario because there is nowhere that a young person can go for long-term care except a nursing home. Madam Speaker, we must do better, and the pandemic has highlighted these issues. Lives have been lost. Our loved ones, friends, family members lacking the safety, care, and resources to stay safe, and in the most dire, and finding themselves in the most dire of circumstances, even trying to survive. And Madam Speaker, we know through what we've seen in long-term care that we cannot leave it up to companies whose purpose is to make profit over individuals to determine who is worthy and who is not. All beings are sacred and worthy of care, and unfortunately, for-profit care homes have not demonstrated this, as witnessed in Parkview Place, a Revera care home in my very own riding of Winnipeg Centre, where too many lives were lost. One life is too many lives. Friends, families, loved ones, and workers. I wish to extend my condolences to all of those who have been impacted in my community and across the country. And it is alarming, Madam Speaker, because while for-profit care homes have only 1/4 of nursing home beds in Manitoba, they account for 44% of deaths that have occurred so far during COVID-19. We've heard stories about poor quality food, individuals left in rooms with COVID without care, so many lives lost. This is a crisis. Life is precious. And this is not the fault of workers. I want to be very clear, Madam Speaker, many of who also lost their lives as a result of poor working conditions in long-term care. And I have to say, it is very clear, certainly we knew it before, but since the pandemic, we know now, it is very clear that care work in this country is not nearly valued enough. And groups more predominantly impacted, we know it's most predominantly impacted are women, and in particular, poor BIPOC and immigrant women who often are in precarious work situations and face exploitive working conditions. This is unacceptable and needs to end now. In fact, there's numerous reports, Madam Speaker, that indicate that many personal support workers were not even provided with adequate PPE during the pandemic, having to supply their own protective gear from home. This is totally wrong. This is totally unacceptable. It is a total disrespect to workers and residents. Care workers who are entrusted to care for residents for long-term care, at the very least, deserve a living wage, benefits, safe working conditions, and security. And that is why I am proud. That's why I'm proud today that the NDP is proposing to take profit out of long-term care and put an end to public subsidies for profit operators who have paid out millions in dividends to shareholders. That money needs to be invested in caring for people, loved ones, friends, family members, and ensuring safe working conditions for care workers. The NDP understands this. This is why we have called on the need to develop a regulated system of long-term care. National care standards that include accountability mechanisms supported by federal funding, and improving working conditions for frontline workers in the long-term care sector. Madam Speaker, it is time for a living wage, proper training and resources required to improve working conditions, in turn supporting better quality care for residents of long-term care. And the way forward, we must immediately work towards putting an end for-profit long-term care. Madam Speaker, seniors have inherent value in society, elders. And I know for Indigenous cultures, even globally, they are the backbone of our societies. They guide and direct decisions. And even today, they are key decision makers in our nations. Seniors did not just build this country. They continue to be leaders in our communities. And their knowledge and wisdom, Madam Speaker, are essential in learning how to understand the world around us and how to live, not just survive, but how to thrive. They are the ones that give us guidance about how we must move forward. And Madam Speaker, when I think about my ancestors and the many elders I look to for guidance even today, I have to acknowledge, and I think we must all acknowledge, their profound wisdom. And it's for this reason it is so disturbing. It is so disturbing that elders and seniors in our community, what we saw in long-term care, they're almost treated as if they are disposable, locked away in institutions where they aren't even afforded basic human dignity. This needs to end now. Madam Speaker, I wanted to share that because we often speak about elders, about their vulnerabilities and weakness, but rarely do we look at the strength, resilience, wisdom, and leadership, an essential part of our communities in which elders are critical. I wanted to end by taking a little bit of time to talk about the culture of ableism. because I think with everything we've been debating in the House that it's important to talk about ableism. For far too long, ableism has shaped long-term care. And this is seen through how we fund and organize institutions from staffing.
I am sorry, but we are out of time. The